Do you get lower back pain in the morning when you're first getting out of bed? Mornings can be difficult for people with various types of lower back pain, and particularly when they're rolling over in bed, sitting up from a laying position, or going from sitting to standing and taking their first few steps. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain 3 different ways how to get out of bed without your back hurting in the morning, as well as what not to do. So first of all, let's go over what not to do. A typical way that many people get out of bed is they sit up and they kind of get themselves oriented, then they swing their feet to get out of bed. But when you wake up in the morning, if you've been laying with your back arched all night long, and then you go to sit up and use your hip flexors to help lift you up, particularly if your abdominal muscles aren't that strong, your hip flexors pull you into even more back arch, and that jams the joints in your lower back together. If you do have degenerative disc disease or spinal stenosis, it can also pinch on the nerves and irritate them, which is not a good way to start out your day. So I would highly recommend, no matter what type of back pain you have, that it's probably not a good idea to sit straight up like that when you first get up in the morning. So what should you do instead? Well, the textbook way that they tell you to do it in physical therapy school is this way. When you roll over on your side, you want to roll your whole body as a log, rolling like this. You don't want to twist your upper half first. You also don't want to twist your lower half first, because your lower back was not made to twist. The way that the joints are aligned, they kind of sit inside one another. And so when you twist too far, it jams the joints into one another, regardless of whether you twist top first or bottom first. So you want to try to roll your whole body as a log. And if you're too close to the edge, you may have to kind of scoot yourself over in bed a little bit to give yourself enough space to log roll over onto your side. Then once you're onto your side, you want to take your feet and hang them over the edge. Now your feet are going to drop down and give you leverage to push your body up. So you're going to come up in a sideways position. You're going to take your arms and put them on the bed, kind of dig this elbow in and push up with this hand. And you'll come up to a sitting position like that. Now, one important point here is when you go to sit up like that, you do want to keep your abdominal muscles tightened, kind of do a little crunch as you're sitting up, and that'll prevent your back from arching too much as you sit up. So you let the feet drop off, dig the bottom elbow in, push with the top hand, keep your abdominal muscles tight, and come up to sitting. Now you still have the task of getting up to a standing position. And to do that, if you just stand straight up, again, you're going to kind of arch your back more than is probably ideal or comfortable. And so you want to try to scoot to the edge of the bed and get your feet on the floor with your abdominal muscles still tightened. So you're in a little bit of a hunched over position. And you scoot to the edge, and then once you're hunched over at the edge with your feet on the floor, then you lean forwards and then push your hips back underneath of you to stand up. And so that's a much more comfortable way to start out your day than just trying to sit straight up from bed. And again, that's the traditional way that they teach you in physical therapy school to get a patient out of bed in the hospital, or to have people get out of bed if they have back pain. But I like to think outside the box and always try to turn good enough into better. And so here are a couple ways that I've found that eliminate that step of having to sit up, which is probably the most uncomfortable part for people who have lower back pain if they're using that technique, because there is still some side bend and twisting component involved. And sometimes people with lower back pain still have trouble sitting up out of bed using that technique. So here's another way to do it. Instead of rolling onto your side, you're going to roll a little bit farther, and so you may need a little more space. Roll all the way over onto your belly. Let one leg hang off. Bring the other leg off. Then you can use your hands to get up to an upright position and you skip that whole step of having to sit up. So again, give yourself enough space where you can roll all the way over to your belly if you're on your back, or if you're on your side, it's even better. If you happen to wake up on your belly, which I don't recommend that as a sleeping position overall, especially if you have lower back pain, but you may just find yourself woken up there and there's not too much you can do to control that. So if you do wake up on your belly, that's a great way to get up. But again, if you're on your back, you want to roll to your side, rolling your whole body at once. Roll again to your belly. Step one leg off. Step the other leg off. Use your hands to push up to a standing position. So that's the second way to get up in the morning without back pain. Now, the third way kind of combines the first method and the second method and takes a little bit of the best of both. Because some people with that second method still have trouble rolling all the way over to their belly. That extra roll can be a little bit hard. Plus, you need a little bit more space to be able to do that if you're already on your back. So, combining the two methods, if you roll over onto your side, put your feet over the edge of the bed. Now you're going to take both feet and straighten them out and bring them both down to the ground at once. So you roll off the edge of the bed and land on your feet, and then push up to a standing position. Now, I would recommend having someone around the first time you try that, because you are literally rolling out of bed and you don't want to roll out of the bed onto the floor. So for safety's sake, make sure there's someone around the first time you try it and make sure you can do it effectively. But I found myself just doing that intuitively, getting out of the bed in the morning, rolling to the side, hanging the feet off, and then pushing up that way. So hopefully you did find this helpful and it helps you to start your day out on a better foot without your lower back hurting. Now, if you are in the St. Louis area and you need more help for lower back pain, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else but you found it helpful, give this video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.